Apparently 35% of the world's population has oily skin. That is 2.8 billion people dealing with the effects of oily or combination skin. And of that 2.8 billion, 60% also have sensitive skin. So in today's video, I'm speaking with cosmetic and medical dermatologist Dr. Nora Jafaar. She's from the Rejuvenation Clinics in the UK. I asked for questions from you guys here on YouTube, as well as my friends over at Instagram, and Dr. Nora will be answering those for us today and giving her expert advice for those with oily or combination skin. Let's get started. So, Dr. Nora, thank you so much for joining me here today. Welcome to my channel. I'm thrilled that you could join us today. So thank you for giving us your time.
Thank you for having me. It's really exciting. Something new for me. So always good to branch out.
So you actually have a few channels yourself. So I'll make sure I put details on all of that below. But maybe we start off with you telling just a little bit about yourself and why this topic of oily skin is of particular interest.
Yeah, definitely. Thank you. So yes, essentially what I do is I work as a dermatology doctor. So both in the NHS in the UK, so our public sector services, as well as then privately in cosmetic dermatology, which is most commonly known to everyone for where people go for more aesthetic treatments. Mm-hmm. And I think what makes me a little bit different is that most people do come to me for skin and the cosmetic dermatology aspect of it rather than your Botox and fillers and injectables.
Really?
That happens
Are you finding that to be the case?
Yeah, but most commonly people do come to me, and the most common thing I treat, which is not obvious from my Instagram, is acne prone skin, oily prone skin. So almost by default, I think because I treat a lot of it in the NHS and then cosmetically, it's become a huge area of interest for me because I guess I've built up that knowledge and experience base. We've then had really nice success stories, and then by default, your patient base, then you get more patients that want to come to you for that. And then you almost get referred by friends and family and people that know that. So it is definitely the most common thing that I treat, which is really great, but not obvious if you follow me.
No, and it's funny because I get asked that a lot on this channel. You know, what kind of products would you recommend? And you know, how can I deal with some of the factors of oily skin? And I don't really have oily skin. So having you on as my expert just makes me so happy. And I guess it kind of starts with the first question. You know, what is oily skin? What constitutes that? What makes skin oily?
Yeah, definitely. So even myself, I always thought I had dry skin. And then it wasn't until in adulthood, I realized I definitely had oily combination skin. And it massively, completely changed my skin when I started using the right product. So oily skin is essentially categorized by the overactive sebaceous glands, and then they produce excess sebum, which is the natural oils produced in our body. And then what happens is we get shiny appearance, we get enlarged pores, we can then that can become inflammatory, that can attract bacteria, that can become spots. And then, but also that can be influenced by loads of factors like hormones, genetics, environmental, diet. So there's lots of things that can contribute to having that excess oil production in the body.
Okay, well, here's a question, and you just hit it on the head, that you didn't know you had it. And that kind of leads me to this whole conversation with you and how I found you. I feel like we should say it. I met you through a brand that I absolutely adore called Blur London, and I know that you're now carrying them in your clinics. And I found them at a time the opportunity was perfect because I've always had dry skin. And I started doing microbiome tests of my skin. It was probably 2 years ago. And I learned through that I had oily skin. My skin, basically because it tested oily, it didn't feel oily. I do not have big pores. I do not have obvious oils in my skin, but it turns out I actually did have oily skin. So how would someone know? Like, how do you know if you think you're not, but you actually might be?
Yeah. Key signs, it's for basically determining whether you have oily skin. So really commonly is people tend to have a shiny appearance to their face, mainly in the T-zone area. So you're thinking about forehead, nose, chin area, sometimes the mid-cheek as well. Now, like you said, that's not obvious, especially in cases like yourself. Other things we tend to get is we get enlarged pores, again, around the mid-face area. Now, also what tends to happen is people will notice that, for example, women, when they wear makeup, a couple of hours later, the makeup isn't quite sitting right. It's sliding off their face. It's not got that kind of matte appearance. You're noticing when you look in the mirror, you're having to reapply. It's sitting in like the creases, or it's slightly falling off. That's another key sign. Also, another thing is kind of the skin texture. It just feels oily to touch. A good way to test it is if you wash your face and a few hours later, you just blot it with some tissue paper. Obviously, you can see if it picks up oils or not. Now, you may have not known you had oily skin because you might have, felt dry. So what happens is if you're not using the right products, if you have oily skin, you have open pores and then the oils are seeping out. So you feel dry. So you might then put products on your skin for dry skin. And sometimes people with oily skin, they don't moisturize at all. But that's because they feel like they're oily. In your case, your pores are open, your oils are seeping through, you felt dry. So that's why you might have been using them products that might be feeding that negative cycle of oiliness, if that makes sense.
Interesting. Yeah, that makes perfect sense. Okay. So those of us out there like me in their 50s that might think they're dry might not actually be dry. That's food for thought, isn't it?
But also because of the hormonal changes that happen around that age category in women, our estrogen levels drop. We tend to have more androgens. So androgens are kind of the male dominant hormones, which both men and women have. When they become more predominant, so that's things like in puberty, at time of the month in menses, and sometimes during menopause as the hormones change, or with HRT, so hormone replacement therapy, that can change the level of oil production in the body and therefore affect the skin type. So
that's me too.
Lots of things in our life that can change that.
She said never sticks around, does it? There's no sort of constant either. There just
Good
isn't.
luck.
So what would you say are some specific challenges that the oily skin faces?
Honestly, the most common thing I see is it's so difficult to find the right skincare products because you're trying to balance the moisture. You have to find something that's going to hydrate you without adding excess oils. And that's really, really difficult in the industry. I think there's either really hydrating and luxurious and oil-based products, or you have things that are like acids and actives and harsh chemicals that are drying you out. So it's really hard to find a nice balance to that, and that's the most difficult
And
thing
that's
I
key,
see.
isn't it? Is like what we want is balanced skin. And that's what I learned by doing the microbiome tests, that the best thing you could do is have a balance. Like our face is a ton of microbes, right? And it's if everything's being fed properly, then your skin is happy. And it changes. It does change. So that what we're trying to achieve is the balance. Okay, so you need hydration, but you also need to keep it clean, a little bit
And
of
you need to do that whilst going through life, whilst your stress levels are going to change, whilst your diet's going to change, whilst your environmental factors are going to change. So if you go on holiday, it's more humid, you're going to get more oil production. If you have a big weekend of drinking and takeaways, that's going to trigger more oil production. If you're going to be more stressed, that's going to increase your cortisol levels, and cortisol levels are directly linked with more oil production. So it's all these factors whilst we're just living life that are going to affect the levels of oil. So it's really difficult to then find products that work for you all the time.
Just going to say it's a minefield. Like, how are we supposed to do that? Like, I mean, obviously going to an expert like yourself. I've never been to a dermatologist, by the way. I have a suspicion that I'm going to be visiting one of your clinics soon. Is that I'm always trying to do things at home. And let me tell you, a lot of times that goes wrong because I think my skin is one thing and your skin tells you when it's not happy, right? Whether it gets irritated, it tries to get rid of stuff. Like, I know when my skin isn't happy. So how does a person navigate? Like, do you have any general tips for those of us or those of others?
So I always say to people, you need obviously a proper skin diagnosis. We need to understand like what your diagnosis is. So is it just oiliness and open pores? Is it inflammatory acne? Is it non-inflammatory acne? Is there hormonal acne? Is there other elements to it? Once you understand what the key things are going on, you can then tailor the right kind of routine where you can chop and change at different times. So for example, I might give somebody with like oily prone or acne prone skin, I might say, look, here's a generic routine. For example, like I might use Blur. I say, look, here's a cleanser with very mild salicylic acid. Here's a toner. Here's a moisturizer that's not going to clog your pores. But if those times you're noticing you're getting breakouts, I'll say add in this prescription cream, add in this prescription product. So that week where there's excess, there's stuff going on, you then use the really high strength stuff that's obviously prescribed by your doctor. And then you don't have to use it all the time, but you can have it there as and when you need it. And equally, you can then obviously, it's all a holistic approach. So then we need to obviously think about other things like supplementation. So for example, I always recommend like zinc and omega-3 supplements to everybody that I treat and see. It's very difficult to do studies with when it comes to nutrition and dermatology because it's so difficult to control all the like other factors.
Yeah.
But what we do know is zinc is anti-inflammatory, very good at controlling oil production. And omega-3, funnily enough, on the flip side, is very good at maintaining your skin barrier and actually kind of nourishing it and making sure it's kind of nice and content. So those two actually work really well. So I do give them to all my patients and clients who come in. I say, regardless, zinc and omega-3 are going to do really well to control the oils, but also to maintain that barrier of the skin. So it's about a combination, looking at their diet, their lifestyle, their stress factors, what's happening in their day-to-day, so that you have your kind of bread and butter like routine, if you like, and then you need to obviously put the medical hat on, add all the other elements as you can.
Yeah, so to your point, is diagnosis is essential.
Correct diagnosis, yeah, exactly, 100%. It's not just acne, it's not just oily skin. It's more than that. Yeah, so going to the right person that will understand that will be key, because you can't just give someone Roaccutane if they've got, you know, more hormonal based acne, or they're actually it's because of their diet or environmental factors. That's not the correct treatment for them. So
right, okay. You need an expert. I think I need you in my life. I swear, menopause is just the gift that keeps on giving, you know.
Yeah.
It ain't simple. Now, what's interesting is that I heard recently that sort of heritage as well as geography can really also have an impact on oily skin. Is that right? That products that are made in certain areas are there to suit certain skins. Is that right?
Yeah. So it's funny because obviously you always see different skincare brands will be produced usually from like a certain heritage or ethnicity, because they've developed certain problems and issues. Most of the best solutions come from problems that you found yourself. And so obviously that's why lots of mums with babies tend to develop baby ranges for skincare, or you have Afro-Caribbean type skin, which produces skincare specifically for them because they find that the other generic brands don't work. And that's because a lot of skincare brands aren't tested on lots of different ethnicities as well. So it's very difficult to pick out the right ones. But yes, definitely we know that, for example, Afro-Caribbean skin, so Fitzpatrick skin type, 4 to 6. So if you look at the Fitzpatrick skin type scale, they produce more oils because they have kind of lower ceramide levels in their skin. So they naturally will produce more oils. However, that also makes them then feel more dry. So they're a really tricky category to treat, because they want something that's super hydrating, but also something that's not going to clog the pores, that's non-comedogenic, that's not going to contribute to more oils. So that's kind of, you're looking at the oily combination skin on the extreme level, and that's because of the way their skin genetically works and because of their heritage. So yeah, very important when you're bringing out a skin, or you're trying to recommend skincare products, is also that that factor of what's going on in your family history, hereditary aspects.
Yeah, that's so interesting.
Yeah.
And do you know what's funny is that I found, and I think half of it is trying to stay on top of it and realizing that your skin can change, because I've always thought I had dry. Now, I skin tested my face 3 times in the course of a year. I was super oily, and then I was balanced, and then I was super dry. And I don't even understand it. The first time, I think the super oily was because I had a big change in my diet. I got rid of all the sugar in my diet, and I was going through a sort of a clean out of some, to some extent. And I think that's what really had the massive impact. So then I balanced. In fact, I was using the Blur products, which, interestingly enough, I continued to use even after I tested normal. Because they're strangely hydrating without stripping, even for normal to dry skin, which was shocking. So it does make me wonder, how often is that change happening? And is it something we need to stay on top on? Can you visually look at skin and see it change? If I'm coming into you twice a year, would you be able to see you've gone from oily to dry? Is it visible to you? Really?
Yeah. So one skin cycle is 6 weeks, so 42 days. So that's the time it takes for your skin to literally go through one skin cycle. So therefore, if we're trying to change someone's skin, I always say that first 6 weeks is the transformation stage. So we're trying to literally tell your skin cells, stop producing oils, or don't do that, or, be different, essentially. So therefore your skin can change in 6-week cycles, either for the better or for the worse. So that's how I kind of assess anything in terms of when I'm doing injectable treatments or when I'm recommending skincare products. It has to be in 6-week chunks. And I always say, like, come for a review at 6 to 12 week intervals. The first 6 weeks transformation stage, 6 to 12 weeks, is more kind of when you can up the ante, really your skin gets used to things. And at 12 weeks is really when people start going, wow, like when you really use products that work. It's that kind of 12-week sweet spot is always when you say, right, things are clicking, your skin cells have changed their behavior, they've got used to things, and now they're kind of just coming and stabilizing. And then after 12 weeks, really you're in kind of maintenance phase most of the time. Obviously that's kind of the majority, not everybody, but you can definitely tell, when you see people, because their skin type can change. And I've seen that happen in clinic. I'll see people 6 months later and go, what's happening? What's going
on here?
Yeah. And sometimes we need to, change some of the product. It's a myth that your skin gets used to products. That's the myth, that people think, oh, my skin is got used to this product, so I need to change something. And that's something I hear all the time. It's not that. It's that your skin is changing, whether that's because of environment or stress. I spent 3 to 4 weeks in Thailand in April, May, and my skin became more oily because I was always in really humid conditions.
Yeah.
So even when you go abroad, you notice the people that live in that area, you'll notice change. Well, I'll notice changes in their skin, and I'll say, right, everyone here has sebaceous hyperplasia. Everyone here's got really rough skin texture. Everyone here has, and I'll notice things and I'll be like, oh, everyone here's got pigmentation. So you'll notice certain traits in different areas of the world when you travel around as well.
So fascinating. So what you're saying is after a 12-week period, if you get to a point where things are good, you should just stick with it, unless you're trying to tackle something in particular.
Yeah.
But if you've got nice balanced skin, everything's looking great, there's no need to start chucking a bunch of stuff at it or make changes to it. Just ride that wave of happiness.
Exactly.
And
And the best skincare plans will have like 1 to 2 actives that are actually going to target what the diagnosis is, and the rest should be very simple, balanced products. There's no point me throwing 5, 6 actives at you. There's just no point. They'll all interact with each other. They won't work. They cause problems. 1 to 2 key things, per 6 to 12 weeks to actually try and target the problems. And that's the key really to getting actually good changes in your skin.
Okay. So let's talk about the one thing I hear people talking about constantly, pores, right? Let's talk about pores. So can you change the size of pores or minimize them, or, do you got what you got, or can you make the situation better?
So we all have pores. Yeah, we all have pores. What they do is they actually start as something called sebaceous filaments, which is really, really normal. It's kind of the little just dots on the nose. Yep. And then pores can happen. So basically sebaceous filaments are what channel oils through the lining of the pores to go to the skin surface. So we all have pores. And then what happens is they just get larger or smaller over time, depending on what we're using. Now, if someone has more oily skin, those oils kind of push through. They help the pores get bigger and bigger. Unless we're doing something to shrink them and dry up the oils underneath, the pores are going to stay big. So the key thing is actually to chemically exfoliate the skin. And what you want to do is use something like salicylic acid, because what that does is it literally exfoliates, so unclogs the pores. Once the pores have been unclogged, then we need to close them and shrink them. So then you use salicylic acid to unclog them, and then you use retinols to increase the cell turnover so that they don't stay big. So those are kind of your key 2 big ingredients for someone who wants to shrink the pores.
So that was my next question. Or what are the ingredients that that oily skin needs to be engaging with? And I assumed salicylic was going to be at the front of that.
Yeah, salicylic acid is your top one. That just unclogs. It literally chemically exfoliates. And then you've got things like zinc that control oil production, and it's also anti-inflammatory. So if you are oily to acne prone skin and you're getting that inflammation and bacteria, zinc is a great anti-inflammatory to have in skincare products. And then you've got niacinamide, which is another great one, because that helps regulate the oil production and improves the skin texture.
Yeah.
So kind of those 3 are the key ones that I look for, or I recommend my patients look for in the ingredients list. And I always tell people, top tip, if something isn't in the top 3 ingredients of that product, it's just not in it at all. So don't bother.
Fair. That's good advice, actually. That's really good advice. So would you see the salicylic acid would it be effective in a cleanser? Would you feel that you're getting enough from a cleansing phase as opposed to having to try, a separate exfoliant, for example?
Yeah, so definitely. So cleanser is the best way. If you're removing makeup, for example, if you're a woman or man, if you're removing makeup, you want to basically oils remove oils. So it's the only time I really allow oils in a routine. When I say if it's your first cleanse, you
Okay.
need something oily to remove the oils. But then you must double cleanse with something with a bit of salicylic acid in it, because that's actually going to go a bit deeper and get rid of all those oils that are getting stuck there. Because otherwise, that's what's just going to attract bacteria and inflammation and cause spots. So the key thing is drying up the oils that are sitting there with salicylic acid.
Okay, so that's interesting. So first cleanse should be oil based. So we're doing a balm or
Yeah.
an oil. Yeah, I mean, I
Yeah,
think
and that's
most of
if you're
us
not
do that
wearing
anyway, but
makeup.
that makes sense. Get
Yeah,
the
go
makeup
straight
off.
for it. But always have something salicylic acid. If you're not wearing makeup, go straight for it. Or if you are, then you
But
can
you
you
usually
can
have
remove.
sunscreen on, right? Everybody should be wearing sunscreen. So I assume you
Exactly.
still want to use the oil as a starting point.
Yeah,
Yeah.
definitely.
Okay, so let's talk about acne because I think there are different types of acne. Like I'm seeing women of my age that never had acne, getting that menopausal hormonal situation. Tell me
Yeah.
about the different types of acne.
Okay, so the way I kind of categorize it is you can have comedonal acne, very common, your blackheads, your whiteheads. That needs essentially things like salicylic acids and topical retinoids. That's your kind of common, oily skin type brushing over into acne. Then you have inflammatory acne. Now, this is more kind of categorized by red, swollen pimples,
Yeah.
papules. They can
Angry.
become exactly a bit more angry. Now, for that, as well as the salicylic acid and retinoids, what I would add in is something antibacterial. So that's when you can use topical like clindamycin. Sometimes we give people tablet antibiotics to take long term, and that can help if you have more inflammatory acne.
Okay.
Then you have the nodular cystic acne. Now, this is kind of when it's more severe, it's coming through. That's where you're worried about it's going to cause scarring. For nodular cystic acne, that's when you should really be going to a dermatologist to look at options like Roaccutane or things that are more systemic that are going to work stronger, because then you need to dry up the oils from the inside out. So
Okay.
sometimes topical things aren't just going to cut the mustard. And we want to try and capture treating it really before scarring develops.
Early before it gets, yeah,
Exactly.
to
So
a,
nodular cystic acne is the key one when you really need to get to your doctor. Now, the waiting list is about 12 to 18 months in the
oh,
UK. It's crazy. So the earlier you can start using these products, even in like puberty or teenage years, is better to prevent it coming as well. And then you have hormonal acne, which is more kind of with time of the month and that is really characteristic along the jawline and chin area. So if it tends to be all over, then you're looking at the other categories. But if it tends to just be here and it's with time of the month, then you're looking at more hormonal. And for that, we'd give more contraceptive medication, things that control hormones. So basically contraceptive medication or medications like spironolactone and things like that. But then you're looking at more tablet medication that is more effective alongside the topicals.
okay.
So
That
yeah,
makes
4
sense.
different types in my head, make it easy.
Okay. Okay. So next, I thought we would do some myth busting.
Yeah.
And you probably can add to this. I have a few that I've heard, and we'll go through it real quick and see what your thoughts are. I hear all the time oily skin can't wear moisturizers.
Yes, and I briefly touched on this earlier. So it's a total myth.
Yeah.
Oily skin needs moisturizer. If it doesn't have moisturizer, the pores are more open, the oils seep out, you produce more oils because you feel dry, and it's a negative cycle. You need a moisturizer to almost put a lid on it. You need to maintain that skin barrier, but you need a moisturizer that obviously doesn't have oils in it. So things like hyaluronic acid based moisturizers, they're very good because they will hydrate you without
Yeah.
making you feel oily. And you want something that's going to help close the pores,
I
essentially.
would say you'd probably want to go for lighter textures too, not the big heavy
Exactly.
creams, obviously,
Exactly.
something that
Yeah.
feels a bit lighter on the skin. Another thing I hear a lot is that people with oily skin need to do some serious cleansing more than other people would. Like that squeaky clean, get everything out,
Yeah.
almost harshly cleansing.
Yeah. People get there saying, I
I
scrubbing
did
it.
that
No.
when I was
Yeah,
in
I
high
know.
school.
It's so bad. So we always say in dermatology, so chemical exfoliation is better than physical exfoliation. Now, if you use harsh cleansing, you can damage the skin barrier. When you damage the skin barrier, that can cause like a dermatitis. When that happens, that can cause post-inflammatory hyperpigmentation. So then that causes that kind of darker marks on the skin, especially if you're a darker skin type. You have to be really careful with introducing like harsher forms of cleansing. So I always say it doesn't need to be harsher. It just, it needs to be clever cleansing. So use a chemical exfoliant that's
Thorough.
just going to unclog at that level, but like your beta hydroxy acids, like salicylic acid.
Okay. So you just need to be thorough and use the right ingredients.
Yeah, exactly, rather than aggressive.
Okay. Here's an interesting one that I had heard is that fatty foods, like if you eat a lot of oils, it's going to make your skin oily.
Yeah. So very interesting, because obviously it's complex. Nutrition and dermatology is so hard to kind of research accurately, but we know that foods that have a higher glycemic index, so things like higher refined sugars and carbohydrates, can spike your sugars obviously systemically. When that happens, that can lead to increased oil production. So that is a factor. So higher glycemic index foods can contribute to anything that increases sugar content. So, and equally, dairy, that's kind of the most well-known one that's associated. But interestingly, low-fat alternatives like skimmed milk versus full fat is worse for your skin than the full fat. So we either say avoid dairy altogether, or if you're going to eat it, just eat the full fat
The full
option.
fat stuff.
Yeah, because when they're skimmed, they basically have all additives. They're more, they're highly processed. They have more sugar content added to them. So those ones have been more linked to more acne, more skin conditions.
That's so interesting, because I wear a glucose monitor because I've really gotten into understanding. And glucose hides everywhere. I mean, that's sugar, it's everywhere. So that's great to know that I'm actually helping my skin as well, my externals as much as the internals. So that's good to
And
know.
equally, like I said before, with fatty foods, like obviously you have the ones with omega-3, like, you know, salmon and things like that, and fatty fishes. They're great because they repair your skin barrier and they're anti-inflammatory. So they're really, really good if you have kind of acne-prone skin, because it's anti-inflammatory as well.
That's great. Okay. There's another one I heard that was quite interesting. So if you have oily skin, that means you're acne prone. Would you say that's true?
So they overlap. So you can have people with oily skin that can make you more susceptible to then having bacteria, inflammation, and, you know, nodular cystic breakouts.
Causes acne.
Exactly. Right. But you can also have people with oily skin that never develop acne. And you can also have acne, which is triggered by other factors like, you know, environment, stress, genetics, hormones. So they do overlap definitely, and having oily skin makes you more likely to develop acne, but it's not necessarily as black and white as that.
Okay. Okay. So next, what I did is I went out to my community, both here on YouTube as well as my friends over on Instagram, and I asked them for questions that they could give to you, questions that they wanted to have answers to. So we'll go through a few of those. The first one was, apart from SPF, what is the best thing I can do for my skin?
So do you know what, from a young age, and I wish we knew this more, it's definitely, obviously SPF is just number one up there, but it's things like, you know, avoiding sunbeds, know that your SPF wears off, try to just maintain and protect your skin barrier. I'm even now seeing so many young children try and get into loads of actives and harsh ingredients.
It's killing me.
It's just not necessary unless you're going through puberty and your oils are changing and your hormones are changing and you are getting more oily acne skin. There is no need. Just protect your skin barrier. Don't overuse skincare products. Simple cleanser, simple moisturizer. That's all you need, just to kind of get rid of the day and then moisturize on top. Something really, really simple. So I think that's the main thing, is just don't overuse skincare.
Don't overdo it.
Because I see so many problems with adult acne has actually happened from things that we're putting on our skin, or problems that we've created for ourselves, for example. So yeah.
I may have done that on a few occasions. May have screwed up my skin. Anyway, back to basics. Back to basics. So the next up is, what's the best for teenage skin, specifically blackheads around the nose? I don't know if you have anything other than what we've already talked about there that might be helpful.
Yeah, I think the most thing is teenage skin means, you know, puberty, and puberty means hormonal changes. Hormonal changes mean you have more androgen, so more male dominant hormones, whether you're a female or a male. Now, so we just need to control that oil production. So it all comes down to then salicylic acid. You don't need to start using like a retinol specifically in your teenage years, because again, that's kind of increasing cell turnover, maybe stripping the skin barrier, but definitely cleansing with something with a bit of salicylic acid in it, just very mild, like 0.5%, like we have in the Blur one, actually, the cleanser, I don't have it with me, 0.5% in the Blur cleanser, or going up to like a 2% salicylic acid in some other kind of generic brand cleansers. That is enough to just start to control the blackheads specifically as well, because blackheads happen when you have open pores and then the oil sitting there are whiteheads, and when they come up to the skin surface and oxidize with the air, they become black. So that's why.
Okay. I actually think the most important thing is getting them to wash their face. I have teenager. I have another one that's 21 now, but it's like I have to go and say, go wash your freaking face. Which is in the morning, I'm like, go put your freaking SPF on. Like, you're not leaving the house without SPF, and you better go wash your face off at night. I mean, it's hard to get teenagers to do anything, but that probably the simplest thing is just wash with the right stuff and moisturize,
100%.
and that should be enough.
Yeah. because otherwise the oils build up, the bacteria builds up, and it's the same as when people get like gym skin. So a lot of people that exercise a lot, it's basically just you've sweated, you've had your day, you've exercised, or you've worn headgear or things like that, and then just the bacteria is just sits
leaves
and
it there.
sits. Yeah.
Yeah. Yeah. Okay. Next question. What are the best ways or ingredients to keep milia at bay? Milia are tricky little guys. They're hard to get rid of. Do you have any
Yeah.
particular advice around those?
So yeah,
Probably don't
milia.
pick them, I imagine you're going to say.
So milia is very interesting. I think a lot of people think they're kind of like spots or they're oils. They're not. They're keratin-filled cysts. So literally the dead skin cells that rather than kind of flaking off, they've become trapped. Now they really commonly happen around the eye
Right
area.
here. I've had them.
Exactly. And a lot of the time it's from overuse of eye creams and like heavy eye creams or things that we've put on to clog the skin. Sometimes they just happen spontaneously. You can get primary milia, which just happens spontaneously, or secondary milia, which is when we've used something to clog the skin. So every time I see patients with milia and they, for example, didn't have it last time I saw them, I'm like, what are you using? What have you bought? I'm like, you bought something. I know you're using a new eye cream.
Nothing
And
gets
usually they're
past
like,
you.
how did you know? And they're like, oh no. So it's really difficult to remove them kind of just with kind of products. You either need to kind of go for something a bit stronger. So to prevent them, something with your beta hydroxy acids, or to remove them, you're looking at really kind of going for either manual extraction or chemical peels, or retinoids are quite good because they increase that cell turnover. So those are things you're kind of looking at. But yeah,
It can just be a
preventative.
waiting game sometimes. Just use the
Yeah.
retinols to get it out. Okay.
But heavy creams are just the key cause for milia around the eyes. It's just dead skin that's just been trapped,
It's
unfortunately.
trapped. Okay. Next up, could antidepressant medication have changed my skin type from dry to oily?
So, very interesting question. They can't directly cause your skin to become oily, but a lot of antidepressant medications work on the hormone serotonin. And by doing that and changing your serotonin levels, that can affect your oil production. So indirectly, it can cause your skin to become oily, but I wouldn't say that like, yeah, all
It's
antidepressants,
causing
there's
it.
so many categories. Yeah, they can't cause oily skin, but yeah, it's all related to kind of your serotonin levels that affects your hormone imbalance, and that can lead to more oil production. So it's just something to be aware of, which type of antidepressant you might be taking, and just keeping an eye. And always think of your skin in 6-week cycles. So if you've noticed changes in the last 6 weeks, you're noticing changes, start introducing some of those products we talked about earlier.
Okay, that's good. Is there anything to be done for sebaceous filaments on the nose?
Oh yeah, so essentially, yeah, they're the channels that carry,
That we were just
oils to
talking
the
about, the
pores.
pores.
Yeah, very common, very normal. A lot of the time people will think they're kind of blackheads and want to get rid of them. They're super normal. The main thing is don't pick them. That just makes it worse and makes the pores bigger, but it's really tempting. They can be reduced, again, by chemical exfoliation and retinoids, because what you want to do is you essentially just want to dry out the oils and then increase the cell turnover to kind of shrink the pores overall. So yeah, those are the two key things that are going to reduce that appearance. And you'll notice that go over 6 to 12 weeks.
Okay. I would like to know how to prevent acne on the jaw due to hormones, oily skin, and menopause. So how do you get rid of that hormonal acne? Or
Yeah, so
prevent it? Actually, it says prevent. How do you prevent it?
okay. It's difficult because you won't know necessarily when your hormones are changing unless you're either specifically taking synthetic, hormones, either in hormone replacement or the contraceptive pill. So because we typically know hormonal acne will be around the jawline and around the chin area, that is obviously a key teller. To control that, we need to re-regulate the hormones. Now, a lot of people, they don't want to take hormonal medication. There's been a big shift in people kind of wanting to put synthetic hormones in their body. So it's difficult to get them to then regulate it with hormonal medication. Some people are, up for it, and that's great. Otherwise, there are other medications we can try called spironolactone, which work quite well to regulate kind of the hormones and therefore the oil productions associated with hormonal changes. But then, to be honest, the topical treatments for acne in general will help. And sometimes it might just mean that when it is that flare or time of the month, you need to just use, like I said before, those more prescription strength products alongside your kind of maintenance routine. So you might just notice that you might just have to switch things up depending on when your hormones are changing, which is completely doable. And then you can, go back to normal. So it's just about being aware.
That's to say, you probably kind of have to see the cycles, see, where these changes are happening and be able to
Yeah.
preempt them by,
Yeah.
supplementing it with different pieces or different products. Okay.
Exactly. They might even mean switching up your, hormonal medication. So if a pill isn't working for you or the coil isn't working for you, to then try something else that doesn't, affect that as much.
Okay. One of the last things I want to talk about, or I want to ask for your opinion on, is what I know people want to know.
Yeah.
What products can you recommend for people in this space? Now, we talked about, the types of things. I don't know if you want to get into particular products or brands or whatever, but
Yeah.
people often say, I don't know where to start. Like, where do I start?
Yeah. So there's loads of really affordable and underrated products on the
Right.
market. The reason I actually, obviously, we connected and I love Blur so much is because it's been a really easy product range to give people who are basically active naive. They've never used acids, they've never used actives. Some have never done anything apart from splash water on their face. And obviously, but equally, I've got the other end of the spectrum where they've spent 800, 900 pounds on skincare from, fancy retailers, and they've just gone, it's not working for me. So therefore, using something like Blur London, where they've managed to combine some active ingredients like salicylic acid, but for example, in like 0.5%, where it's not going to irritate the skin, and also blended it with really calming ingredients that again are going to allow your skin to get used to it. What I do is I would give that as a product range and say, here is your day-to-day, morning and night. It's not going to cause any problems, which it doesn't. And it's really been really good. It's genderless, so really good for men and women. It's simple. It's 3 steps. And on top of that, what I then usually do is, based on our assessment, and for example, that maybe the type of acne, if it's hormonal or inflammatory or comedonal, I will then add in a couple of higher strength, like medical grade products that are just going to target maybe that specific thing. So for example, I might add in like azelaic acid if they've now developed mild rosacea because they have oily skin as well. And that's the kind of prescription cream that they can add in alongside it. So, because I always say the key thing, like I said before, is a couple of really strong stuff to tackle what your diagnosis is. If you need it as and when, in your 6-week skin cycle, but your day-to-day should be very simple with kind of 1 or 2 actives like salicylic acid and zinc, or, niacinamide, which Blur London just kind of prioritizes. But also with hydrating elements that are going to maintain your skin barrier. And I think that's the main thing, is how do we balance the oils whilst maintaining the barrier? And I think you need basically more products like that are easy for everybody to access, because there's no point recommending cleansers that are £200.
No, because that's the thing, is they're so affordable. I mean,
Exactly.
like crazily affordable. And
There's not many in that range where it's affordable, but
no.
very kind of medically orientated, if that makes sense.
Yeah, and the other thing I want to emphasize, because it was one of the issues. Now, I live in Ireland. You're in the UK. These products come from the UK. It says it in the name, but most of my audience is based in the US, and you can have this sent over, and you don't have to pay any import charges, and that's huge for a brand to do that. So, I mean, they pay import charges to a lot of different places. There's no reason not to try it, and I mean, I think it's great, and I've used it, and I'm surprised at how well it works on what I think is drier skin. I think now I'm going to be coming to your clinic and getting an assessment done.
And that's the main ethos of the whole brand, which is why I love it. It's all about inclusivity. It's genderless. It's tested on every skin type. It's just calming. Like it really does just want to give something to people to be like, don't worry, you can start with this. And I just love that about it, because it's been people who aren't into skincare, it's allowed them to actually like come into the crazy world of skincare.
And that's saying a lot, because you have clinics, and I know you sell other high-end brands here. I know what you carry, and to see that this is in there too says a lot. From a dermatologist that's just trying to take care of skin. So so I'm so thrilled that I got to meet you, and I want to thank you for taking time out of your day to chat with me. And I'm actually starting to think I have oily skin, and I think I don't have oily skin. So I'm going to come and visit you the next time I'm in London. You can count on that. So listen, thank you so much for your time today. I enjoyed this. You're a great crack. you're good fun.
No, we could talk for hours.
We really can. Yeah. And I don't know if our guys want to be sitting here listening to us chat all night long, but we're probably going to continue. So thank you for joining us today, Dr. Nora. I hope that my viewers got as much out of this chat as I did. And I think that, knowledge is power, right? So the more we know about how to take care of our skin, the better. So everybody, I hope you enjoyed it as much as I did. And if you have any additional questions for Dr. Nora, just put them down below. I'll get in touch with her. We'll try to get answers for you. Thank you so much for joining us here today. And I look forward to seeing you in the next video. Bye.
Thank you so much for having me.